Happy New Year and welcome back to Kahali. I know it's been a long break, and a lot of you were asking me where I've been or what we're doing. And I just wanted to say that I think everybody needs a break, and winter's been really cold. So, took a little Christmas break, if you will, and now we're back. And back with a very important topic, which I personally feel is not being given the kind of importance and heft that it should be. And part of the reason, of course, is we're seeing all these political rallies going on. We're seeing people walking around without masks on the streets. So there's a feeling of things sort of being normal, but they're far from it. And that's why I've invited Dr. Abdul Ghafur. Of course, you're familiar with him. He's joined us previously as well to discuss the pandemic and the various stages of the pandemic. He's an infectious disease expert and has been tracking this extremely closely. So, Dr. Ghafur, welcome. Happy New Year to you. How happy should we be in this new year?
Good evening. Happy New Year. We should be happy. We should always be happy. The Omicron will come. COVID waves will come and go. We need to carry on with our life, but in a very
Hmm.
cautious way. We
Very
had first
cautious, but
wave.
that's not.
Yeah, carry on.
Go ahead. Go ahead, doctor. Go ahead, please.
We had the first wave. Then we had a massive Delta wave. We are facing an Omicron wave now. The beginning of the Omicron wave. But we
Hmm.
faced the first wave and second wave in a very courageous way. Yeah, we had some issues with the second wave around the world, and now we are facing
Mhm.
the Omicron wave, and we have to deal with that as well. We don't need to be panicky, but we need to be careful.
But, doctor, back in November or so, it was actually feeling like, things were returning back to normal. Most of us have got vaccinated, double vaccinated. And there was a sense of optimism. And, of course, it's also the festival season. So everybody was feeling very buoyant. And then suddenly, 2 weeks ago, this started again. And we still don't know how mild it'll be. There are reports that suggest that this is milder than Delta, which was frankly devastating where I am, which is in the NCR. It was a really bad time, and we saw oxygen shortages and all of those things. And now people are saying that Omicron is very transmissible, but it is milder. Now, is this true, or is this all we know so far?
Omicron is highly transmissible, and as far as we know, it's milder compared to the Delta wave. If you look at the Omicron, we got the first news from South Africa, and when we got the first news few weeks ago, we are really scared. This Omicron variant has dozens of mutation in the virus, especially in the most important spike protein. We're really scared because a virus with so many mutations, the spike protein, should be so dangerous. But now we are a bit happy because we know the virus is highly transmissible despite more than 30 mutations in the spike protein. But if you compare that with the Delta variant, the virus is less severe. And the recent publications confirm the initial observation by the South African doctors. Yes,
Hmm.
the virus is several times more contagious, is spreading so fast, and the doubling time is just 2 days. That means today, if you have 1,000 cases, day after tomorrow, that means after 2 days, is going to be 2,000. After 2 days, 4,000, 8,000, 16,000. That's a very short and very fast doubling time. That's why Omicron is spreading so fast across the world. At the same time, the virus is less severe. It's producing less severe symptoms in individuals who got infected with the Omicron variant. One of the reasons could be a virus with so many
Hmm.
mutations. A virus mutates to survive. And a virus has so many mutations, is probably in a defensive mode because it has to survive. That's why there are so many mutations. And anyway, the recent publications confirm that the Omicron variant is producing less severe disease than the Delta. That's very good news indeed. But it's highly transmissible. It's spreading across the world in several countries like UK and USA and several other countries. The Omicron has taken over the Delta. In a matter of few weeks or a month, most of the countries, Omicron will be the most predominant variant. Is it a good news or bad news? There's good news and bad news. The good news is that a virus that is highly transmissible, lucky for us that it's less severe. It produces less severe disease. In one way, it's good. If it replaces the dangerous Delta, that's good for us because then the world will have a less severe disease. That said, during this transition period from the Delta to the Omicron, we are going to face a massive Delta Omicron wave. Yes, the transition from Delta to Omicron is good, but during the transition, we will have large number of patients infected with Omicron. Even if what we believe is Omicron is more than 50% less severe than Delta. If you compare it with Delta, it's at least only half severe compared to Delta. That's very good news. But even if the severity is half of that of Delta, if a virus is spreading very fast across the world, including our country, we have a large number of patients infected. And there will be large number of vulnerable people, which even the less severe Omicron can kill. The hospitalization rate of Delta was around 10%. The hospitalization rate of Omicron is 1%. But we should not forget that we are dealing with a highly contagious, highly transmissible virus. Even today, the Indian Statistical Institute in Bangalore came up with a prediction. The Omicron wave has started. The peak will be the end of January and the wave will be over by the end of February. That means in 2 weeks' time, we'll have a very sharp and steep peak. And at the height of the peak, height of the wave, we may have anywhere between 3 lakhs to 10 lakhs cases a day in our country. It can be anywhere between 3 lakhs and 10 lakhs. Is it going to be 3 lakhs per day or 10 lakhs per day? We can't predict. That there are so many factors determining the peak number per day. But even if it is the most optimistic prediction of 3 lakhs per day, even if, let's take it as 5 lakhs, between 3 lakhs and 10 lakhs, 5 lakhs. And even if the hospitalization rate is 1%, Delta was 10%, and Omicron, the lowest is 1%. If you have 500,000 patients a day and 1% get hospitalized, we'll have minimum 5,000 admissions a day in the country. And we have got admissions every day, anywhere between 3,000 to 6,000 admissions every day. So if large number of patients are infected, we'll have large number of admission. But let's hope the admissions are going to be less than that during the Delta wave. The Delta wave, we had a tough time in the beginning. It's unlikely we will reach to such a bad stage during Omicron. Because hospitalization and the Delta wave, the peak number was 4 lakhs a day. And we are expecting anywhere between 3 to 10 lakhs during Omicron. And the hospitalization rate is going to be lower during Omicron. Let's hope it's going to be a less severe hospitalization wave during Omicron. But we need to be careful. It's not going to be a nice scenario. Omicron is not going to be that nice on us. But personally, and several others believe that the transmission from Delta to Omicron is good for the world. But be careful during that transition period. After all, Omicron is a COVID virus. It's not going to be so nice on us.
No, and also, it's not necessary that Omicron will be the only variant, because I was reading today that France has found something. I think it's called H1 something. I'm not sure. It doesn't have a name as yet. And like you pointed out to me, WHO has not kind of responded or reacted to it. But the French are claiming that it's even more transmissible than Omicron. And doctor, one more question I want to ask you, a layperson's question, is when we're saying more transmissible, does this mean that the behavior we have adopted for Delta, which is to stay masked, to social distancing, will those things work with Omicron as well?
First of all, the what French has identified a few days ago, the IHU variant. That virus has more number of mutations than Omicron. But we don't know the severity is same or less than Omicron. It's too early to identify. The WHO will look into it. WHO hasn't labeled it as a variant of concern yet or interest yet, and let the WHO and the French team work on that. And second question, whether the masking, social distancing is going to be less effective against Omicron than Delta? Probably yes, because it's highly contagious. When we are dealing with a highly contagious, the mask may not be as effective as during Delta, but that's only one side of the argument. There's a difference of opinion among experts. Some experts believe that a highly transmissible virus, when you use a cloth mask or a surgical mask, it may not be effective. We may have to use an N95 mask. But some of the experts believe that a surgical mask could be effective, and we may not be able to say Omicron a mask is going to be less effective. But anyway, we need to mask up. Whether it's going to be equally effective or a bit less effective, that's the best defense is masking. And during Delta wave, now we know that a masking can reduce the chance of getting COVID by 50%. You wear a mask, you've got a 50% less chance of getting COVID. And we know that many of the vaccines, the effectiveness is the same, 50, 60, 70%. A mask is almost as effective as a vaccine. So mask up during Omicron. Social distancing is very important. Follow social distancing during Omicron wave. And most important, avoid unnecessary gathering. Any gathering of more than 50 individuals should be avoided. Massive rallies are not good for us. Omicron will enjoy massive rallies. It's highly transmissible, and several of you may be young and get away with Omicron, but your elderly parents, your relatives with cancer, diabetes, heart disease are not going to get away that easily with Omicron. Omicron kills less than that of Delta. That's all. Still, Omicron is a COVID virus, highly contagious. It kills people.
There's a question, is it airborne?
In the beginning of the pandemic, we thought COVID is not airborne, just spreads by droplet. But later scientists changed the opinion, and even Delta, the COVID virus, is airborne, not just droplet borne. It's spread through air. Omicron also, like Delta, spreads through droplet and spreads through air. Yes, COVID is airborne, Delta is airborne, Omicron is airborne.
Okay. And doctor, one has been hearing reports of, in the US at least, of children being impacted by this virus. And, there are certain reports, even in India, there was a TV actor couple whose child had very high fever and was in the hospital. So, of course, parents are now getting very worried, because so far we've seen that Delta didn't really impact kids. It was dangerous for everybody else, but kids were somehow still protected. What is the case with Omicron? What are you all seeing?
See, during the Delta wave, we thought adults are affected and children are significantly less affected. And then the zero prevalence studies that we conducted in our country proved that more than 50% of the children are affected during Delta. We did not know that because they did not have any symptoms. So almost 76-80% of the Indians, 76% of the Indians are seropositive. I mean, they had COVID knowingly or unknowingly after the Delta wave, and more than 50% of children were affected during Delta. So most of the children are affected already, and during Omicron will affect adults and children. Probably more children comparatively could be affected, but we are not expecting any preferential involvement of the children with Omicron. Omicron is going to affect adults. Omicron is going to affect children. So let's not be worried much unnecessarily about a massive wave among children. Of course, but let's not forget that Omicron is going to affect children as well and adults.
NR is asking, how come some COVID virus, Omicron, affects human body in a different way than Delta? This is because of the mutations, I imagine. And also he's asking that Omicron does not seem to be impacting the lungs or creating that kind of respiratory distress that we saw during Delta?
The Omicron variant is different, significantly different than the Delta. The Omicron has more than 30 mutations or genetic changes in the most important part of the virus called spike protein. That makes a lot of difference. Number one, yes, the Delta wave significantly affects lung. Now, Omicron wave is less pathogenic or less, it affects the lungs significantly lower than the Delta wave. The Omicron wave significantly affects the upper respiratory tract, your nose and upper
Mm-hmm.
airway, rather than the lung. Of course, it affects the lung as well. But Delta is on the other way. Delta causes serious damage and involvement of the lung. And Omicron involvement of the lung is probably 10 times lower than Omicron. But let's not forget that even the upper airway involvement of Omicron can trigger the immune mediated pathway, and that's the one cause systemic damage. So even if the lung is less affected, still Omicron can cause damage of the lung, of the heart, and other areas like muscles through immune mediated pathway. Let's not forget that.
Mm-hmm. And there is this question about this being compared to the common cold. So Arun Rao is asking, will our RT-PCR tests then be able to detect between a common cold and Omicron, because everybody is saying that the symptoms are very similar? And just to add to that, now Israel has found something called the Florina, which is a very pretty name for a virus. In my opinion, it sounds more like a perfume, but I believe that's also quite unexpected, and one doesn't know what that's like.
Number one, now, is Omicron like a flu, ordinary flu? No, Omicron is a COVID virus. Don't ever compare Omicron with a flu. Flu is usually a milder disease, except in highly vulnerable. Omicron is not. Let's not forget that at least 1% of the individuals affected with COVID, and probably more, it can be 1 to 5%, will get hospitalized, and a lot of people will die. Number two, regarding the clinical presentation. And if you look at the Delta wave and the first wave and the Delta wave, a lot of people had loss of smell and taste. That is less common with Omicron. The loss of smell is less common with Omicron. And if you look at the Delta people, if the Omicron, a lot of people are complaining of running nose and nose congestion. And that was less during the Delta. Delta was predominantly high fever and cough, dry cough. While Omicron, yes, dry cough and cold, running nose. So Omicron is, yes, a lot of dry cough and cold, while Delta was predominantly cough without cold. And Delta, we had a lot of people with high fever. That kind of high fever is less common with Omicron. Yes, there are some differences in the way people come to us. Most of the people coming to us in the clinic over the last 1 week, yes, we are facing a steep increase in the number of patients coming to my OP with COVID, but majority of them are having mild symptoms. That was not the scenario during the Delta. We used to see more severe patients even the beginning of the Delta wave. So looks like Omicron patients are comparatively having less severe symptoms, but still we need to wait and watch. And number 2, 3, your question about test. Yes, the Omicron is a COVID virus. The PCRs that we do for the COVID or the Delta will detect the Omicron as well. So the test that we do in the country, the PCR test, antigen test, there's no difference. There's no difference in the pickup with that of Delta. Now, with the Omicron, some of the PCR tests can identify Omicron in the PCR itself, because we call something like a yes gene, yes for sugar, yes gene drop out in the PCR. That's an indicator that the virus could be Omicron. Of course, if you doubt that in the PCR test, we need to send this isolate to a National Institute of NIV Pune for genome sequencing and confirmation that it is Omicron. But we can get a clue in the beginning itself in some of the PCR methodologies. So yes, PCRs detect Delta, PCRs detect Omicron. They're all COVID virus. We are not going to miss any Omicron in the PCR test. They are equally effective against, sensitive against Omicron and Delta. Coming to the funny name you mentioned, the flu,
Florina.
plus corona,
Florina, Florina.
florona. Okay, what a florona. Now, some media, many television channels have reported a new variant of COVID called florona is identified in Israel in a patient. Florona is not a new variant. One patient in Israel, one pregnant lady, was infected with COVID and also infected with the flu. That's
Hmm.
not something that should be unusual. Flu is common. Corona is common, and both are spread through droplets and airway. So it's not unusual at all or surprising at all if a patient has both virus. Now, if everybody now, before the COVID pandemic, I used to test a lot of my cancer patients, anybody with pneumonia or running nose, I used to test for flu. Now, during the COVID pandemic, not just myself, across the world, doctors reduce testing of the flu. We are all testing with
Hmm.
COVID, COVID, COVID. Now, if you start testing for the flu again, even in those individuals with COVID, currently we don't do that. Once COVID positive, come on, you have stopped testing and treat for COVID. Now, if you test for flu as well, in many of these COVID patients, I can guarantee you flu will be positive. So that
Hmm.
is the florona. It's not a new virus. It's just a
Okay.
condition where a patient has two viruses.
This is an important question. Wants to know that whether people will get affected by the black fungus, like we saw the last time round.
We don't know. We have to wait and see. This black fungus infection is more common in India. During the Delta, we had a massive outbreak of a black fungus infection in the country. And
Hmm.
that black fungus infection was several times more during the second Delta wave than the first wave. And that was due to specific characteristic of the Delta virus itself. We don't know how Omicron is
Hmm.
going to create the changes in black fungus. We don't know the understanding between Omicron and black fungus. We need to wait and see. They may be helping each other, like Delta and black fungus were helping each other. We don't know. We have to wait and see the incidence of black fungus during the Omicron wave. Or maybe there are new surprises. We don't know.
Yeah, that sounds ominous. The more optimistic view of this is that, and some doctors believe it, others are not willing to stick their neck out on this one. But they're saying that this could be the beginning of the end. Because when a pandemic gets less fatal, less kind of dangerous, then you're seeing it easing off, going kind of on its way out. Are we being too optimistic, or is this a reality, possibility?
I will explain two scenarios. Number one, Ebola. Ebola, except the last massive outbreak of Ebola, Ebola always kill people between 100 to 200 because it's a deadly virus. You get Ebola, you're almost always dead. Once you are dead, you have less chance of passing over the virus to others. So a deadly virus, very deadly virus, usually don't become a pandemic. You don't have a pandemic of Ebola across the world because it's deadly and less
Hmm.
contagious. You need very close contact with the secretions for Ebola to spread. So a virus that is very less contagious and very deadly will never produce a pandemic. At the same time, a virus that is moderately transmissible, moderately contagious, and kills in a medium way is a perfect virus to create a pandemic. That's why COVID is a perfect virus for a pandemic. It's acceptably contagious and it kills in a moderately strong way compared to Ebola. Compared to Ebola, COVID is more contagious and kills less number of people. So it has got enough opportunities to spread across the world. Now, Omicron is more contagious than the previous variants of the virus and probably less deadly. And that kind of virus will spread even faster in the world and kill less number of people later. During the transition period, yes, it will kill a lot of people. But after a few months, probably it will be nice to have a virus that is less deadly than Delta. So Omicron, I believe Omicron is a act of Mother Nature as one of the methodologies to end the pandemic. We don't believe the COVID is going to disappear from the world. No, we will have a less virulent, less deadly virus called Omicron in the world. Now that's only a prediction. We don't know what else is Mother Nature is hiding. We may find more mutations, and who knows, one day the Omicron may combine with Delta and maybe or similar variants and produce a highly transmissible and very deadly virus. Let's hope that's not going to happen. Let's hope we'll have a virus that is highly transmissible and less deadly. That's what we want. That's what Omicron is. Let's hope Omicron is going to be the virus that is predominant in the world of the coming months or years, so that we will be having comparatively far better life in the world.
So masks are something that we have to now just accept that we're going to have to live with for a long, long time.
For a very long time, we have to hide our nice and pretty faces behind the mask. A very bad scenario, though. People are hesitant to show their faces nowadays.
Yes,
People
yes,
won't
absolutely.
remove the mask. You ask people,
Except for
can I see
politicians,
you have to, and you ask people, can I see your face? They're so shy to remove the mask. And that's one way is good. We have got so used to the mask. It's become a part of our life, a part of
No,
our global culture.
Anubhav is asking, if we witness a surge in cases again like last year, should we go about our business while taking all the precautionary measures instead of shutting down everything unnecessarily, he believes? What about the vaccine cocktail?
Number one, lockdown. We must avoid a lockdown as much as possible. I will recommend a lockdown or a week or two or maximum 3 weeks if the number of cases jumps above 5 lakhs and the hospitalization significantly increases and we reach a stage that we can't manage patients anymore. Only if this unfortunate scenario unfolds, we can consider a lockdown of 2 or 3 weeks. Let's hope that's not going to happen. People have suffered, economy has suffered, and economy is just recovering. People are getting their jobs back, and we can't let our economy suffer again. We can't let our ordinary business people and shop owners shutting their shops and allowing their families go into poverty again. Let's hope we will not have that scenario again. And the question about cocktail of vaccines, it's proven that if you mix and match vaccines, the effectiveness is comparatively more. There are plenty of studies from the global literature on that. There are very limited Indian data on the mix and match of our Covaxin, Covishield, and Sputnik. So far, when we start the booster dose or the precautionary dose from 10th of this month, as per the health ministry decision, we are not encouraging the mix and match. We will be getting the same vaccine that we got last year. The first 2 doses and the precautionary dose is going to be the same thing. That's a current decision. Situation may change in the future, and health ministry after a month or two may decide, the precautionary doses or boosters are going to be different from the initial 2. Let's wait and see.
Mm-hmm. And how reliable are those home rapid tests that we all now can get at medical stores? I think they're not that expensive, 250, 300 rupees or so. And you can test yourself at home should you feel symptoms coming on. How reliable are they?
There are different types of rapid tests. Some of them are good, some of them are not very good. Some of them detect the infection in 50 to 70% of the cases, and some of them less than 50% of the cases. You get the best one rapid antigen test possible, but even if the antigen test is negative, you're still feeling unwell, do a PCR test. A PCR test is far more sensitive than the antigen. But if the antigen is positive, that's it. You don't have to do a PCR test. Once antigen is positive, that's COVID. But if the antigen is negative, it could be still COVID. You may have to do a PCR.
And if someone does get Omicron, do they have some natural immunity against getting COVID again? Like, are they immune from, say, a Delta variant or another variant? Because earlier on it was said that if you have COVID, then about 2 months, 2.5 months or so, you are immune from further infections.
The Omicron, overall, if you get a COVID infection, including Delta, you are relatively immune for getting COVID for 3, 6, or 9 months after that. A protection almost as good as that of 2 doses of vaccine. No vaccine gives 100% protection. No previous infection gives 100% protection. Now, the data from Omicron One particular feature about Omicron is we call immune escape. That means even those individuals protected with a vaccine, the COVID can produce a breakthrough infection. Even those individuals who had COVID earlier, Omicron can produce a breakthrough infection. But those people who had COVID earlier or vaccinated earlier, or those people who had COVID earlier and vaccinated earlier, the chance of that breakthrough Omicron infection produce a severe infection is very low. So it's always better to get vaccinated. You are lucky if you had COVID earlier and then you got vaccinated. That's the best combination. We call it as the hybrid immunity. But even if you don't have hybrid immunity, the 2 doses of vaccines you receive will protect you from hospitalization to a significantly great way.
No, that's really a relief to hear. And this is really a wait and watch game. From what I'm getting from what you're saying, is that at this point of time, we don't have to worry too much about how severe this is, because as of now, it doesn't seem like it's that severe as Delta. However, in a matter of weeks, it can all change.
We have to wait and see that the information that we get from several countries like South Africa, UK, and Denmark, the data is encouraging, but so many people are dead in these countries. We should not forget that. Let's wait and see what's going to happen in our country. We need to expect around 3 to 5 lakh cases a day. Hospitalization will increase. So many people will die. Let's hope that the situation that we are going to face is not as bad as the Delta wave. But still, we need to be careful. We need to continue masking, social distancing, avoid large gatherings. Please get vaccinated. If you're not vaccinated, please get vaccinated, because the data from all the countries show that those people with Omicron infection getting admitted and hospitalized and dying are the people who did not receive vaccine. That's a very important message. So please get vaccinated and don't avoid large gatherings, large functions. It's not going to help anybody.
No, I know today in the news there was this cruise ship, Mumbai to Goa, which has something like 60 people who've tested positive. So it's just insane.
Yeah, by the time they come back, all will be positive.
Yeah, pretty much. That's how fast this vaccine is.
Yeah.
I mean, not the vaccine, the
Omicron is. Yeah.
And just a larger question, and this is my final question for this evening, so thank you for sparing the time, is that these kind of pandemics is something that we should be future ready for. This is a new reality. The last time we saw something like this was the Spanish flu, and now again COVID. Are we now heading into a future where viruses like this will happen, and it's not something we should take for granted?
As we speak, we are facing multiple pandemics. We faced the first wave, the second Delta behaved like an entirely new virus. Omicron is behaving like another virus. Actually, we are facing different types of pandemics of the COVID virus itself. No doubt, if we have one pandemic like of this magnitude, we will face more pandemics in the future. We have to be future ready with pandemic, and one way of being future ready is vaccines can play a very important role in preventing pandemics or in controlling pandemics. But that doesn't mean we have to spend all our resources on vaccines. So my suggestion will be all countries should have the facility to manufacture vaccines like India has. The way we control the pandemic is we have got such a wonderful pharmaceutical industry, Indian pharmaceutical industry. We are the pharmacy capital of the world. We have our own vaccines like Covaxin and made in India vaccine like Covishield. And then we have got more and more made in India vaccine coming up. And we are able to face, we are not dependent on foreign vaccines at all. Yes, we may get the technology from other places, but we manufacture it. Our companies manufacture it. And that is the way forward in preparing and controlling the pandemic. World should learn what India has done in the COVID vaccine field. It's easy to purchase vaccines from other countries by spending all the resources that we have, which re-emerging economies like India and other countries cannot afford. But we have a large capacity of manufacturing vaccines because we have got such a wonderful, efficient pharmaceutical industry in our country.
Thank you, and that is really really an optimistic note to end this discussion on. I again thank you, Doctor, for joining us at short notice. I feel like I'll be wanting to invite you again because this is going to be with us for a while. From whatever you've said and what I'm reading between the lines, is that this is something that I think 2022, a good part of 2022, is going to have us a little puzzled about what lies ahead. But thank you. We're better off today than we were 2 years ago, or 1 year ago, or even 6 months ago, because we have more information, we have more tools, and we know better how to protect ourselves. So hopefully, we'll be able to use all that knowledge for the benefit of ourselves as well as humanity.
Great. Thank you very much.
Okay. Thank you so much. Thank you, Doctor.